Does sleep apnea cause PVCs? If you're wondering whether sleep apnea could be the reason behind those irregular heartbeats, you're not alone. Let's break down the connection between sleep apnea and premature ventricular contractions, or PVCs. First, it's important to understand what sleep apnea is. It's a condition where you stop breathing for short periods during sleep, which can happen multiple times a night. This can lead to various health issues, including problems with your heart. Now, let's talk about PVCs. These are early heartbeats that can make your heart feel like it's skipping a beat. They can be triggered by many things, including sleep disorders. Research shows that there is a strong link between sleep apnea and heart arrhythmias, including PVCs. For instance, studies have found that treating sleep apnea can lead to a significant reduction in PVCs. This suggests that sleep apnea might be contributing to these irregular heartbeats. Here's how it works. Sleep apnea causes intermittent hypoxia, which is a repeated lack of oxygen. This can lead to increased sympathetic nervous system activity, oxidative stress, and systemic inflammation. All these factors can affect your heart's rhythm and increase the likelihood of PVCs. In one specific case, a patient with severe obstructive sleep apnea, OSA, and frequent PVCs showed a dramatic improvement in both conditions after the PVCs were treated through ablation. The patient's sleep apnea symptoms improved immediately, even though the treatment was aimed at the heart condition. This indicates a possible causal relationship between the two. Another study found that patients with OSA who received continuous positive airway pressure (CPAP) therapy saw a reduction in their PVCs. This further supports the idea that treating sleep apnea can help reduce PVCs. So to answer your question, sleep apnea does not directly cause PVCs, but it can significantly contribute to the development and frequency of these irregular heartbeats. Treating sleep apnea can help improve heart rhythm and reduce the occurrence of PVCs. If you're experiencing both sleep apnea and PVCs, it's crucial to address both conditions to improve your overall health.